The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters with Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. It's hard to believe we're celebrating our 10th anniversary of the Health Matters radio program. We're planning some special shows to celebrate the milestones, so hope you'll all stay tuned. So let's begin today by thanking our sponsors, Studio Arts and Glass, Cleveland Clinic Mercy Hospital, and of course our socially distant technical producer, J.D. DeAngelis. Joining me is Brad White, a compounding pharmacist, and our special guest, Dr. Michael Tempel, and cancer nurse navigator Kim Brown from Cleveland Clinic Mercy Medical Center. Good morning and welcome to the show.
Thanks for having us.
Okay, March is National Colon Cancer Awareness Month, and we are helping raise awareness and joining the effort to help save lives. According to Colorectal Cancer Alliance, colorectal cancer is the third most commonly diagnosed cancer, and it is the second leading cause of cancer death in men and women combined in the United States. Family history, ethnicity, and race can put you at a higher risk for colorectal cancer, so screening is an important factor for you to stay healthy. Early detection is key, and today we're going to talk about detection, treatment, and more. We'd like to remind our listeners that our programs are available on our podcast feed. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime.
So, Doctor, welcome back to the show. It's been a while, but we're pleased to have as you and your guest today. Introduce yourself to the audience along with explaining your roles at Cleveland Clinic Mercy Medical Center.
My name is Mike Tempel. I am a colorectal surgeon here at Cleveland Clinic Mercy. I've been here for about 6 months, and I'm excited to bring this service to
and my name is Kim Brown. I am a cancer nurse navigator here at Mercy Medical, and I help navigate the patients through their cancer journey.
Kim, by the way, is incognito today, so she's voice only. I understand March is National Colon Cancer Awareness Month. Why is this such an important focus?
We use this month to raise awareness about colon cancer and to take action towards prevention. It gives us the opportunity to speak to family and friends in the community about the importance of getting screened. It is a disease that is a high-quality screening and may even be stopped before it begins, but that won't happen if people don't know about it. Breast cancer gets a lot of attention in the media thanks to the women who are strong advocates for their health. And now you would be hard-pressed to find someone who didn't know the importance of breast cancer screening. Colon cancer needs that type of awareness, too, and that's why we're here today.
So, if colon cancer is so common, why don't we hear more about it?
The cancer starts in the colon or the rectum from cells in the body that start to grow out of control. Most colon cancers start as a growth in the inner lining of the colon or rectum called polyps. Colon cancer is the third most common cancer in the United States and the second leading cause of cancer-related deaths in the United States, according to the CDC.
Is colon cancer related to diet, or where does it come from, and why do we get it?
There are risk factors that increase your risk of getting colon or rectal cancer. A diet that's high in fats predisposes you to at least polyps, a family history of polyps. Really, the best bet is just to stay on a diet that's high in vegetables, fruit, and whole grains. You'd like to stay away from red meats, if possible, and a lot of processed meats, and that includes, grilling and things like that. You don't want to drink too much alcohol, and you obviously want to avoid smoking.
If colon cancer is so common, why don't we hear more about it?
I I think it's like Kim said, people are kind of embarrassed to talk about it. Nobody really likes to discuss or talk about that area of the body. Like she said, when I believe it's October is Breast Cancer Awareness Month, and that's really kind of, come to the forefront, and, all the sports teams have embraced it. Everyone knows about it. But when you get to that sort of area of the body, people just don't like to talk about it.
All right. So what causes colon cancer? And you mentioned some preventative tips already. Mm-hmm. I'm sure there's a myriad of things. So what would our listeners need to take away for causes? Cancer in general, basically any type of cancer, essentially results from unregulated cell growth. That's all it is. The cells grow without any sort of regulation or chemical signals to stop their growth. So in the case of most cancers, there are two types of genes that will, I guess the best way is promote or block colon cancer. The two genes, generally speaking, one set of genes are generally termed as oncogenes, and those are genes that encourage tumor growth. When those oncogenes are turned on, then the cells lose regulation. The other set is generally speaking called tumor suppressor genes, and that's exactly what they do is exactly in their name. They turn off cancer cells. So when those genes don't work, the cells grow unregulated. So you either have oncogenes that are turned on or tumor suppressor genes that are mutated or turn off, so they can't work. There are some. I'm sorry. Go ahead.
Go ahead. No, go ahead. Go ahead.
Why that specifically happens, I don't think anybody can give you a definite answer. There are some inherited syndromes that occur where people get colon cancer or rectal cancer at a very young age. That's a minority. Most colon cancers occur spontaneously, meaning you don't have a history, there's no family history, and there's no sort of syndrome that runs in the family that would predispose you to getting. Like I said, most of the time these mutations just happen. And again, a low exercise lifestyle, a diet that has a lot of red meat and a lot of fat, and a diet with low fiber. Those are all sort of traits or attributes that predispose to colon cancer, but it's not just that. It's not if you eat a diet that's low in fiber, you're going to get cancer. It's a whole myriad and multitude of things that have to take place before you get cancer.
So, other than diet, are there other risks for developing colon cancer?
The links between diet, weight, and exercise and colorectal cancer are some of the strongest for their type of cancer. The good news is that the healthy habits are some of the most recommended for prevention of heart disease and diabetes. So you are doing something good for your whole body, not just your colon. So things such as staying a healthy weight, increasing your level of activity, also like Dr. Tempel said, consuming a diet high in vegetables, fruits, and whole grains, eating low processed meats, no red meat, avoiding alcohol, and smoking.
Okay, so when should someone start getting screened?
Screening is the process of looking for cancer or precancer in people who have no symptoms for the disease. So regular colorectal screening is one of the most powerful weapons against colorectal cancer and can often find colon cancer early. When it's small, when it hasn't spread, it's easier to treat. The American Cancer Society recommends people at average risk for colon cancer screening at the age of 45, as people are getting diagnosed younger with colon cancer. They should continue this screening through the age of 75, and some organizations still recommend that at age 50. Ultimately, you should be having this conversation with your physicians about your risk factors and screening needs.
So, no colonoscopy after 75, is that?
Yes, that's what the American Cancer Society recommends.
I guess I would think that as you age, the need for a colonoscopy would increase. No?
Well, I think that's just a general guideline. I mean, I've had patients, in their early 90s that have come back after they've had a colonoscopy that have had a large polyp or, unfortunately, a malignancy. And, I don't think it's the age of 75 per se. I think it's when you get to 75, the odds of you having other medical issues going on that would prevent adequate treatment has to be taken in effect. But I don't use age at all as a deadline to stop treating any type of malignancy or cancer.
So would you recommend other types of testing in between colonoscopies?
There are, ultimately, the colonoscopy is the best way. I mean, the media, and there are good tests. One of the tests that we do really that people are really keen on is the mail-in tests where you send in a sample, and those tests basically look for two things. Number one, they look for blood in the sample, which passing blood when you go to the bathroom is obviously going to be alarming. So they look for blood, and they also look for certain DNA strands. Like I said, most cancer is caused by changes and alterations in your DNA, and those cells are constantly being shed in the stool when you have a bowel movement. So these mail-in tests are going to be they are more convenient. They are pretty sensitive. They actually have a fairly high accuracy, and that's why people are really high on that and thinking, okay, this is going to get me out of a colonoscopy, because nobody wants to do a colonoscopy. I mean, it's inconvenient, and a lot of times you have to take time off of work. The prep for the colonoscopy is not the most fun thing to go through. So obviously I'd be the same way if I didn't, know what I know now. Regardless, if those tests are positive, you have to have a colonoscopy to find out, number one, if there's anything there, and number two, where it is. So the mail-in tests, while they are good, if a negative result comes back, you're probably good to go for, I believe it's 2 years. Every 2 years you need to repeat that test. However, if it's positive, all that tells you is you need a colonoscopy.
But there's other ways of producing blood. I mean, hemorrhoids, things along that line.
Absolutely, that's 100% true. But the hemorrhoids aren't going to be cancerous, so they shouldn't put that the cell's DNA that's changed when you go to the bathroom. But there are many, many, many ways to have bleeding from your bottom. Hemorrhoids is probably, I'd say, the most common. You can have tears around the anus. And you, just because you have bleeding, not every polyp, if there's one found, is going to turn into cancer. There are some polyps which in and of themselves are benign that can cause bleeding that aren't cancer.
Okay, Doctor, I think we'll take a break here. You listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care 7 days a week and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Lots of new stuff at the Half Off and Hot Buy store in Louisville. Just in, L'Oreal No. 7, lots of health and beauty products, plus hundreds of watches, barbecues and lawnmowers, all at the half-off prices. We continue to add new inventory to get ready for spring and summer. Lots of ready-made Easter baskets await you, and not all totally candy-filled, but toys also in the baskets. Stop by, take a look at the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing colon cancer with Dr. Michael Tempel and cancer nurse navigator Kim Brown from Cleveland Clinic Mercy Hospital.
All right, doctor, why don't you tell us a little bit about the colonoscopy procedure? You know, in working in the pharmacy for years and years, anything anybody could do to get out of a colonoscopy, they certainly do it, like you kind of touched on before. So how about we maybe provide some comforting comments to patients to realize that it may not be as bad as it seems and it can be terribly important?
Sure. So basically all a colonoscopy is a camera on the end of a tube, and the gastroenterologist or the surgeon, will place that tube and just look on the inside of your colon. Takes about 30 to 60 minutes. It's done on an outpatient basis. There are two things I think I can almost guarantee. People don't want the scope because they're going to be uncomfortable. Well, that's actually, there are some people that prefer not to have any sedation, but 99% of patients, we have an anesthesiologist or a nurse anesthetist that will administer some sort of sedative and monitor all your vital signs so that you're not awake. I tell people you may fall asleep, but we don't put you to sleep for a colonoscopy. And the other thing, hopefully the worst part of the entire experience is just the prep. And that's where you come in, because they pick up the preps from your pharmacy. Basically, you're going to be drinking this liquid the day before, and a lot of times the day of, a few hours before the procedure. And to be frank, you'll be using the restroom most of the day before, and that's absolutely what we need to happen. The prep is critical, because that's how we look at the inside of the colon. If you're not cleaned out, it's kind of a waste of time, essentially. So the prep is a lot more palatable than it has been, I can assure you. I still wouldn't volunteer to drink it but it's better than it was a few years ago. So,
what about, sometimes I have patients in the pharmacy that say, oh, I got to eat a big meal today because I can't eat for the next, day and a half, or I don't want to eat a big meal today because I don't want to have the prep really keep me in the bathroom all day. Can you myth bust that?
Usually the day before the procedure, you are on clear liquids, and that's not just water. That's just, it's broth, it's Gatorade. You shouldn't be eating a full meal the day before the procedure, because even when you start the prep, you may not get cleaned out. The day before, you're usually on liquids overnight. There are over the recent few years, we've gone from doing all of the prep the day before to doing what we call a split prep, where you do half the night before, then the other half the morning of. Usually it's less volume that you have to drink each day. Usually not a problem with taking your medicines. I know people say, well, I have to take this pill at this time. Excuse me. That's usually not a problem. The only thing that we usually have people not take is anything that's going to cause them to bleed in case we do find something, in case we have to biopsy something or remove a polyp, because obviously we don't want you to bleed a lot. And then people that are on blood thinners, sometimes, that becomes a problem. But it's usually clear liquids the day before. Then you can take all of your medicines with the exception of blood thinners. That's usually what I tell my patients.
One thing if you could touch on too, you've already said that the prep is critically important, but it's important because if the prep doesn't do its job, you can't get a good picture, correct? So then you got to do it again.
That's absolutely 100% correct. And in fact, what I tell my patients is the prep for a colonoscopy is infinitely more important than the prep for actual surgery, because if we can't find the mass of the polyp at the colonoscopy, then we haven't done anything. We haven't done you a service at all. So the prep for the scope is actually, in my opinion, much more important than the prep. Let's say that we found something, unfortunately, and we have to proceed to surgery. I'm a lot less obsessive compulsive about a prep around surgery than I am a prep around a colonoscopy, because if you can't see something on the colonoscopy, you have no ability to, you don't know what you're taking out. You can't see it, you can't biopsy it, is what I tell people.
Well, I guess it's time for a break. Another one, okay? You're listening to Health Matters with the Medicine Center Pharmacist.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
There are no words to describe it. The isolation, the boredom, the loneliness. If you're wondering where your teenage son or daughter's spirit went, you're hardly alone. The past year has been devastating, especially for them. But here's the good news. They might just find it again, playing high school sports. Workouts that stimulate, teammates and coaches that care. The sense of belonging so many of us have been missing lately. That's what school sports are all about. The sense of achievement is real, and the camaraderie is hard to beat. Coping with uncertainty is difficult, but school sports can help the teenagers in your family start feeling like themselves again. Encourage them to give it a try. High school sports. It's so much more than a game.
This message presented by the Ohio High School Athletic Association and the Ohio Interscholastic Athletic Administrators Association.
Provided by News Talk 1480 WHBC.
Cleveland Clinic Mercy Hospital wants you to know we are here for you literally and virtually. For our patients' safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for Stat Care Urgent Care, 7 days a week, and Mercy Primary Care, Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be utilized by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So whether you are in need of urgent care for minor illnesses and injuries, or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Cleveland Clinic Mercy Hospital telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance. Copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by Store in Louisville, next to the Medicine Center Pharmacy.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Do you have to test for blood glucose? We know test strips can be very expensive at many pharmacies. At the Medicine Center Pharmacies, we supply you with a free Easy Max kit, monitor, and strips to either continue or begin with a new blood glucose monitor. And when you buy a package of 50 strips, they're only $7.99. And only at the Medicine Center Pharmacies you'll find this bargain in Canton, Louisville, Minerva, and New Philadelphia. See us on Facebook for more healthcare bargains.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're speaking with Dr. Michael Tempel and Kim Brown from Cleveland Clinic Mercy Hospital. And we're talking about colon cancer prevention, screenings, and treatments. So we have a lot more to cover this morning, so let's get back to the show. So we hear a lot about polyps. What is a polyp, and why worry about them, and why do they develop?
Polyps usually, polyp is just an abnormal growth of tissue. Generally speaking, it's a mass, and not all masses turn into cancer. Overall, the biggest factor that predisposes to polyps is DNA or gene mutations. The cells grow and they're not regulated, like we had talked about before. They don't respond to the signals that would turn off, I guess, normal cells is the best way to put it. So polyps, most colon cancers start out as polyps. The goal is, if we get the polyp before it turns into cancer, then we don't have to do anything. Bigger polyps have a bigger risk of turning into cancer. So on the average, it takes about 10 years to go from normal to cancer. And that whole time, the polyp is getting bigger. So if we can get it at that stage where it's a polyp and a growth, we've done our job, basically.
So, do we get polyps anywhere else?
Yeah, you can get them. You can get polyps in your nose. You can get them in your stomach. You can get them anywhere along your small intestine. It's just unregulated growth. It's like I said, not all polyps are cancer. So there are some colon polyps that, fortunately will not turn into cancer, but the term polyp itself is not relegated to just being in the colon. You can get them all over the place.
What about the individuals who just simply cannot, will not put up with a colonoscopy. What are our options?
Right now, there are, like I said, there are stool-based tests where basically your primary care doctor will give you a kit. You take it home, and you, after the, you usually send a sample in, and what they do is they look for blood and they look for DNA changes. In other words, there are DNA sequences or genes that show up in the specimen that normal colonic tissue doesn't have. So, like I said, a lot of people are kind of turning towards that, and that's the other, the biggest sort of alternative to a colonoscopy. There's also you can do, a lot of times in the office, you can do what we call a sigmoidoscopy, which is a short version where we don't go all the way around and get through the whole colon. However, like I said, that will just pick up things at the end of the colon and the rectum. You have 60% of the colon left to go. That's another way to kind of do surveillance. You can also there are other. You basically can do a stool sample and just look for blood. That's kind of the first warning sign, is that you have blood in the stool. There are CT scans actually that you can have performed where they look, and the way they process all the images sometimes will show something. Again, this is all this is all really a way to avoid having a scope, and that's okay. But if any of those tests come back normal, in order to find the mass or to find the polyp, you have to have a colonoscopy.
So the colonoscopy still is the way to determine.
Absolutely.
There's nothing better. That's the king, right?
At this point, correct. It lets you look at the tissue, and that's none of the other ones give you a direct view of the inside of the colon. So at this point, could that change? I'm sure people are trying to get it to change, but at this point, that's the way to do it.
Okay. So what do we do when we find a cancerous polyp?
Well, the first thing is if we get a polyp and we removed it all, and that comes back as cancer, sometimes that's all you have to do. That's been shown to be effective, depending on how deep it's gone into the colon. Let's say it's a little bit bigger. Well, the next test or the next thing we have to do if it is cancer is, people always want to know, has it spread anywhere? So we usually get CAT scans of your belly and your chest, and we're seeing if it's spread anywhere, because if it has, that changes what I call the plan of attack, so to speak. That changes what we need to address first. So, sometimes sometimes getting the polyp out, that's all you have to do. That's all you need to do. You'll probably need another colonoscopy in 1 to 3 years, but at this point, if we get that out and it's an early stage, we're good. And not everything is, this or that, or you have to, talk to the patient and see what the goals are. You have to take their health status into account. It's not as, black and white as people would think. There are a lot of variables that can, that will affect how you treat the patient, I guess. So if we find a cancer, then we see, has it spread anywhere?
Is obesity a big player here?
Yes, absolutely. That is, a diet high in fats is a predisposing factor to getting cancer. So,
okay. Before we talk about treatments, how about we make sure, you mentioned blood in the stool is a big symptom. Any other symptoms that maybe should be warning signs to people who are delaying having a colonoscopy or a colon cancer screening?
I think the most common thing that people have, they come in, their abdomen or their belly just doesn't feel right. I'm not saying they're in frank pain or, it's horrible pain. Pain is a presenting symptom, but just the abdomen doesn't feel right. The other thing is the second sort of most common thing is that their bowel habits change. They were going fine 6 months ago, and it's gradually gotten harder and harder to go to the bathroom. That's another one. So anything that's, any change, where you're going, once a day in the morning after a cup of coffee, that's great. And now you go 3 or 4 days without having, that's not normal for you, at least. That may be normal for some people, but that's not normal for you. So any change, and really kind of any, a lot of the colon cancers and the rectal cancers they may sort of slowly bleed and be traumatized. So when you start to feel weak, or you feel like, you just don't have the energy that you used to, you may be having sort of a slow bleeding tumor. So, and one thing that is very, very, very common is that, you have, and the word I use is unintentional weight changes, meaning I think it's one thing to try to lose, weight and go on an exercise program. That's outstanding. But when you're not doing anything and you're losing weight, or you're gaining weight and not, your diet's not changing, that's another thing you need to look out for. So, really pain, change in your bowel habits, and unintentional weight changes. And obviously, like we talked about, the bleeding. Why
don't we get on to treatment options for colon cancer? Because I know we want to hear how nurse navigators like Kim can help. So let's talk about treatments, and then we can talk about the importance of the role of the nurse navigator.
As far as treatments go, I think first, obviously, if you have a malignancy, we want to see what stage you're at. And depending on how big the tumor was, or if there was cancer in the polyp, taking that polyp out, that may be all you need to have. And that would be great. Now, there are risks with doing that. But from a practical standpoint, taking that polyp out, if there's cancer in it and we got everything out, it's clear, that's all you have to do. The other option, obviously, is surgery. Taking out the colon, or the affected segment of that colon, as well as getting the lymph nodes, which are kind of that's what you hear, like in women that have breast cancer, they take the lymph nodes in the armpit out to help stage the tumor. It's the same thing with the colon. You have lymph nodes all over your body, so you need to get that segment of the colon out, as well as the lymph nodes. Now, how you do that, we've tended to sort of, open surgery with one incision in the middle. There will never be anything wrong with that, but that knocks everybody down a little bit. I mean, it is painful, and it's, not the end of the world, but if we can get people back to the normal activity, or at least closer to it faster, everybody wants that. So we've sort of started to go to the minimally invasive, or sort of the small incision approach. Sometimes we use, the instruments ourselves, and other times we use the robotic platform to get the colon out. People talk about having their gallbladder out with little incisions, and we can do that now with colon cancer. So that's what we tend to sort of encourage. And some people aren't candidates for that. Some people just need to get the mass out and see what we got. But if we can get you back through the small incisions, as long as we get the same sort of results, meaning we get the cancer out, we get the lymph nodes out, that's the goal. So whether that's via one incision, or one large incision, or 5 small ones, it doesn't really matter.
Okay, Doctor, final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Do you have to blood test because you have diabetes? Is the price of the test strips nearly have you in the poorhouse? At the Medicine Center Pharmacies, we give you, at no charge, a complete test kit with strips as a starter. Then when you purchase more strips, expect a cost savings price of $7.99 for 50. A huge savings over many brand-name test strips. So stop in any Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia for info. Also, we have curbside service, drive-through windows, and free delivery service. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Lots of new stuff at the Half Off and Hot Buy store in Louisville. Just in, L'Oreal No. 7, lots of health and beauty products, plus hundreds of watches. Barbecues and lawnmowers, all at the half-off prices. We continue to add new inventory to get ready for spring and summer. Lots of ready-made Easter baskets await you, and not all totally candy-filled, but toys also in the baskets. Stop by, take a look at the Half Off and Hot Buy store in Louisville, next to the Medicine Center Pharmacy.
We'd like to remind our listeners that our program is available on our podcast. Use your favorite podcast app and go to the App Store and look for Health Matters with the Medicine Center Pharmacy, and we'd appreciate if you'd subscribe.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's look back to the last segment of the show.
Okay, Kim, why don't you tell us how a nurse navigator can be invaluable to patients who are going through a journey and having some colon cancer challenges?
Okay. When people are first diagnosed with a cancer, they're worried about money, they're worried about working, family, and what to expect. So the role of the oncology nurse navigator is tasked with educating the patient and breaking down barriers to care. So the key elements of quality care provided, such as education on treatments, access to clinical trials, care coordination, and also offer psychosocial support. So that's just to name a few of the things that we do here. So we hope you don't need us, but if you do, we are here.
Is there anything being done so far with colon cancer treatments or prevention or research that either one of you are excited about or are taking part in?
I think as far as as far as the surgical boundaries, I think the trend is really getting towards, really kind of pushing towards the minimally invasive surgery or the robotic surgery that we offer here. I think, like I had said previously, if the polyp has cancer in it and it's small enough, well, we've shown, or there's been work that's shown that that doing the polypectomy or removing the polyp is all that's needed to be done, and that's something that obviously everybody wants. Even using the colonoscope to getting polyps that are further in, getting a complete resection, that's actually on the front line as well, meaning as opposed to just getting a piece of what's there, actually removing the whole thing. And the further you get inside the colon, that becomes more and more difficult. But that's sort of the trend, is just getting everything out without having to subject someone to surgery at all.
You know, we're getting close on time, but I want to make sure we highlight, you have a community education program coming up. Do you want to give us some details about that and where listeners can tune in and register?
Community Health Talk on March 31st, and they can find that on our website. It's on next Wednesday, and it's from 12 to 1, and I think it'll also be on Zoom, and people can ask questions. So if they get on our website at cantonmercy.org, it'll be listed there.
Okay, very good. So that's next Wednesday, the 31st at 12 noon.
Yes.
Very good. Okay, great. So, Doctor, do you have any important words of advice for our listeners when it comes to preventing colon cancer that you want to do in the takeaway in our final minutes?
Basically, you want to get eat a good diet, exercise, and get a screening colonoscopy. One thing that I will say is the other reason everybody's concerned about colon cancer is everybody's afraid they're going to have a bag. That is not the case most of the time anymore. So I wouldn't want a colostomy or an ostomy. But thankfully, the technology has come to the point where we can do the surgery without a permanent bag. And I think that's important for people to know.
You know, doctor, so many surgeries are being done robotically anymore. Mm-hmm. These robots must be running 24/7. Is that about right?
It would be nice if it were able to be run 24/7, but we have to have the staff in the operating rooms to be able to help us with the instruments. And, people say that, is the robot going to do it, or are you going to do the surgery? I can guarantee we do the surgery. It's just the instruments that we use the control is much better. And frankly, the picture of what we see in the belly, in the abdomen, is much better. So we are doing the surgery. The robot's not doing the surgery. It's just that the ability to make fine movements and the actual picture itself is much better, or much improved with the platform that we have. So it's gaining more and more ground. I think there are more and more people in more and more specialties wanting to use it. So I think, as far as for colon and rectal cancer, it is a very important adjunct.
How long does it take to train on a robot?
Well, when I at my previous position, they have a pathway. It's not like you decide you want to do it and then they just bring one in to the hospital for you to use. You have to the current company, they have a whole. Basically, it's video games. That's essentially what you do. It's you're learning how to move the instruments, so that's, you have to do those drills, and then you go out and you watch somebody do the procedure, and then a lot of times, someone else, when you're ready to do your first case, someone who has a lot of experience and is sort of a consultant by the robotic company, will come in and guide you through it. So it is a process. It's not just, you decide you want to do it and that's all it takes. It is sort of, I'd say it takes overall, I would say, better part of 9 months to a year just to be able to say that you're certified.
Wow. I think it's amazing. Where do you see this going?
I think, initially it was the first indication actually was, believe it or not, was for heart surgery, for cardiac bypass. That was when it first came out. And then urology kind of picked up on it and used it for some of the prostatectomies that they do for prostate cancer. At this point, I don't know. I don't know where the next step is, but right now, there are a lot of specialties picking up on this. So as far as the future direction, I don't know. Well,
thank you very much, Doctor. I think we're out of time. Dr. Michael Tempel, Nurse Navigator Kim Brown from Cleveland Clinic Mercy Medical Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to the Cleveland Clinic Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.